April of WHO and was mission lead for WHO support to China and to Spain. And Bruce is going to be talking shortly after the regional director here, Hans Kluge, opens with his statement. After Bruce, we're going to move to a panel Q&A where Hans, Bruce, and also Dorrit Nitzan and Catherine Smallwood from the emergencies team here at the WHO Regional Office for Europe will be joining them in answering your questions. We're going to do our absolute level best to get to as many questions as we can during this press briefing. And on that note, I think I'll hand the floor to Dr. Hans Kluge to open. Regional Director.
Good morning. Today we are in the 15th week of our global battle with the novel coronavirus. 15 weeks after the new virus. The first cases in the European region were reported on 24 January 2020. Given the monumental changes that have taken place in the intervening time, I would like to take this opportunity to look more closely at the current epidemiological situation and trends we have observed across the 53 countries in the WHO European region, what we have learned about the virus and how response efforts are progressing.
Can we just check? Can we just make a sound check? Can those of us online hear us? Yeah, sorry about that. Okay.
Thank you. As of today, Europe remains very much at the center of the pandemic. And on the one hand, we have reason to be optimistic, and at the other, to be still concerned. New confirmed cases continue to increase overall in the European region. The total number of laboratory confirmed cases this morning was 687,236, including 52,824 people who sadly have passed away. These data are from 53 countries and 7 territories. We can see there is community transmission in many countries. Cases in Europe account for about half of those globally, with the worldwide toll having increased exponentially. The sharp global increase is due in particularly to the spread of the disease in the United States, which now ranks as the country with the highest number of cases. But the dramatic rise in cases across the Atlantic skews what remains a very concerning picture in Europe. 7 of the top 10 countries that are most affected across the globe are located in the European region. Following USA, we have Spain, Italy, Germany, France, and then after China and Iran, the United Kingdom, Turkey, and Switzerland. We are also seeing higher or much higher than expected levels of mortality from all causes in some countries. This unexpected increase is mainly in people over the age of 65 and is a marker for COVID-19 activity since mid-March. Governments across Europe have responded to COVID-19 using interventions that have imposed different degrees of restriction on the public, schools and workplaces. On the ground, we can see 2 main trends. Some of the countries with community transmission are starting to show signs of a decline in the rate of increase in new cases, following the combination of public health and clinical interventions put in place. While other countries are experiencing a rapid increase in cases or a fresh surge. Looking more closely at the first trend, Spain now has more cases than Italy. However, after 15 to 20 days since restrictive measures were implemented, the growth in cases appears to have slowed and the rate of new deaths is now also showing signs of decline. WHO has just completed a mission to the country, and later on in this briefing we will hear further insights from my colleague Dr. Bruce Aylward, Senior Advisor to the Director General who led this mission. After weeks of strong lockdown, it seems that in Italy, although the number of cases continue to rise, the rate of increase is slowing considerably. However, cases within countries are not evenly spread. Lombardy in Italy and Madrid in Spain are bearing the brunt of the pandemic in their countries. Thankfully, in both, the daily death toll is leveling off. 10 days after the implementation of broad public health and social measures, cases began to decline in Germany. Mortality rates and the median age of confirmed cases in Germany are lower than the average elsewhere. This is linked to a range of factors, including population demography and widespread testing. Further good progress is being observed in Austria, the Netherlands, and Switzerland. We are concerned that Turkey has seen a dramatic increase in virus spread over the last week. 60% of the cases were reported from Istanbul. Cases in Israel, Ukraine, Belgium, and Norway are still on the rise, and there is a fresh surge in Sweden. Turning now to what we know about the virus, the COVID-19 response in countries in the WHO European region is giving us useful information with which to compare the virus in Europe and in China. We now know that the virus behaves in the same way, so we're also learning more about how it can be controlled. Infection occurs across all ages, although proportionally less in children under the age of 15. But the burden of severe disease is greater in older people, particularly men and those with underlying chronic conditions. Every death, however, from this virus is a tragedy, and my thoughts and deepest sympathy are with those who have lost loved ones or are seriously ill themselves. While adults over the age of 60 are at higher risk from complications, the recent death of a 5-year-old in the UK and of a 12-year-old in Belgium tell us that in rare cases, the disease can also be fatal for children and younger adults. Although the majority of cases remain mild, almost 40% result in hospitalization and 5% require intensive care. Among those who have sadly lost their lives, 2/3 are male and 95% are over the age of 60. Most of these individuals had one or a combination of underlying conditions. Cardiovascular disease in 66%, diabetes in 29%, and renal disease in 21%. Knowledge of COVID-19 and some positive signs from some countries do not yet represent victory. They offer a rare chance for us to tighten our grip on the virus. Now is not the time to relax measures. It is the time to once again double and triple our collective efforts to drive towards suppression with the whole support of the society. I call on all countries, whatever their current status of transmission, to strengthen their activities in 3 areas. Firstly, we must protect and strengthen the health workforce and health services at all levels to save lives. Health workers are the backbone of our health services, now more so than ever. We are indebted to all those working day and night to care for people with COVID-19, as well as keep other essential healthcare services operating. Defeating COVID-19 depends on training and preparing the workforce so they can provide safe and appropriate information and care to people and communities, on protecting their physical health and prioritizing their mental health, and ensuring they have the support they need so that their responsibilities at home are taken care of. Yesterday was World Health Day, an opportunity to recognize and applaud the work of nurses and midwives around the world. Once again, I would like to thank them and others working tirelessly on the front line for their bravery, their commitment, and their resolve. Protecting them with the right training, personal protective equipment and support has to be our top priority. I cannot say it better than Laura, a newly graduated nurse in the Abruzzo region of Italy. In her own words, I quote, "For the future, I want to hear discharged patients say, I have survived COVID-19. That is what motivates me and keeps me going. We will do everything that is humanly possible to overcome the situation together, and we will succeed. We must. Never underestimate us nurses. The only thing we ask you is to stay at home for us. We will stay at work for you." Unquote. And there are Lauras in every country of our region, and thank you for your heroism. This brings me to the second area that we must strengthen. It is essential to cut the engine of the pandemic at its source. Separate healthy people from suspected and probable cases. This requires implementing a comprehensive set of early public health measures that consistently includes case isolation, testing, contact tracing, and quarantine. Sustain these measures to delay, slow, and stop the spread of the COVID-19 virus. And thirdly, governments and authorities must maintain a command and control structure and functions, communicate continuously, and engage communities to achieve collective buy-in to current and possible future measures. As is clear from the data and our current level of knowledge, we still have a long way to go in the marathon. And the progress we have made so far in fighting the virus is extremely fragile. To think we are coming close to an endpoint would be a dangerous thing to do. The virus leaves no room for error or complacency. We need to remain committed and vigilant across all regions, all countries, all communities. Any shift in our response strategy, relaxing of lockdown status or physical distancing measures requires very careful consideration. It can only happen with confidence and knowledge of where the virus is and how our respective health services are coping. At a minimum, to keep transmission suppressed, we must prioritize maintaining extensive testing, isolation, and contact tracing measures and planning these ahead, including for the period when widespread physical distancing measures are slowly and gradually relaxed. This is of fundamental importance. At the WHO Regional Office for Europe, we are taking concerted action to support governments make this decision as they transition through phases of their response and eventual recovery. We will deliver guidance on the political and economic, social and behavioral, and health system considerations and implications of strategic shifts in this response. I am convening the European Regional Strategic Advisory Group of experts on COVID-19 next Tuesday to review this stream of work. Next week, Friday, I will convene the Minister of Health of the 53 member states of the European region to share our guidance. Also, developed by the Regional Office this week, we are launching surge planning tools to support member states to visualize acute and intensive care capacity needs over time and the severity of the peak of the outbreak. This is supplemented with policy recommendations on how to create surge capacity in acute and intensive care and includes helpful country examples we are sharing. We focus on the 4 S's of surge planning and delivery: space, staff, supplies, systems. In other news, 2 days ago, we deployed a multidisciplinary team to Belarus to provide support and advice to the country response. And I'm pleased to report that a Polish emergency medical team was deployed to Brescia, North Italy on the 30th of March under the WHO's framework of emergency medical teams to support the conversion of the surgical ward in Brescia's main hospital into the 6th ICU in the town. Solidarity, collective responsibility and perseverance are needed now more than ever to defeat the virus and leave no one behind. While we know that people living with underlying medical conditions are particularly vulnerable, the European region is also home to many others who are vulnerable to the outbreaks of respiratory infections, including COVID-19, because of their limited access to basic health services and health-promoting activities. Refugees, migrants and displaced people, people affected by humanitarian crisis, people in prisons and residents of confined care settings, the disabled, the mentally ill, orphans, those addicted to substance abuse, homeless and those living among us, but on the fringes of our societies. They're all part of the same response, but they deserve additional special attention to address their needs. Many of these vulnerable people cannot easily follow protection measures, such as hand hygiene or staying at home. For those experiencing homelessness, their existing health needs must be met, together with, as COVID-19 specific testing and treatment, access to food and safe shelter. We must stop stigmatization and show solidarity to those who need us, facing this together. We have already seen the impact of COVID-19 in some of these groups. On the 1st of April, Greece detected the first case of COVID-19 in a refugee setting, and now 23 more refugees in the Ritsona refugee camp have tested positive. The camp, which is a temporary home to over 2,300 persons, has now been placed under quarantine. Further cases have since been reported in other refugee camps where similar measures have been applied. It is our ethical duty to offer support, to leave no one behind. Dear colleagues, this pandemic and its impact on our life is exceptional. But every day, every minute we are gathering evidence, sharing knowledge and taking steps to stop this virus and make our health response more robust and sustainable. The virus arrived with us in the dark weeks of the winter. Many of us are looking forward to celebrate Easter with better weather, but this is not the time to lower our guard. We must soldier on. We are in this together and we will get through this together. Thank you.
Thank you very much, Regional Director. So on that, I'm going to pass the floor immediately over to Dr. Bruce Aylward to say a few words. Dr. Aylward is the WHO Director General's Special Advisor, Senior Advisor on COVID-19, and as I said before, has led the missions in China and most recently in Spain. So Bruce, if I could pass the floor to you, please. Thank you.
Thank you. Thank you very much, Rob, and thank you all for just an opportunity to update a little on what was probably one of the most extraordinary missions I've undertaken, and that was the visit to Spain over the past 8 days. And what I'd like to do is share with you a few reflections in terms of what I saw, and also the 4 big takeaways that the regional director and I have been discussing, and their implications both for the response in Spain, as well as the global response. Maybe just a couple of words, first of all, on what we did in the country. I arrived last Sunday and spent the time both in the capital, but also out in 3 of the regions. As you know, in any kind of an outbreak like this, it's extremely important not just to understand what the policies are at a central level, but as importantly, how are they being applied actually in the field, and how are the regions actually experience the outbreak. So I was in Madrid and Barcelona, as well as Toledo, and as you know, these are some of the highest incidence, worst hit areas in this crisis. In addition to the work with the policy folks and the leaders, I also visited 2 of the large tertiary care hospitals that were deeply involved in the response, some of the primary healthcare centers to understand that level, but then also some of these large field hospitals that have been established as a result of the overflow, just a tremendous number of cases that have swamped the system there. So we have quite a holistic view of the response. Also met with experts in the area of testing, et cetera, to understand the strains in those areas. So it was quite a comprehensive look across the full spectrum of what was happening in the country. Maybe a couple of reflections first, just to recap the outbreak outbreak because people are familiar with it. But one of the things that were so striking was just the astonishing speed of this outbreak. If you think back and the explosive nature of it, and sometimes this is forgotten as we look at other countries that have had a very different experience. But if we look at the situation in Spain, you'll remember that as recently as the 23rd, 24th of February, the country was reporting only 2 to 3 cases a day. These were mainly importations on the tourist resorts and islands that the country is so blessed with. So very, very low level. But by the 7th of March, even less than 2 weeks later, all 17 regions were reporting cases. There had been multiple amplification events as a result of importations, a new series of importations, primarily from northern Italy. And cases had jumped from this 2 or 3 a day to 500 cases in a very, very short period. All of a sudden, there was a 2-day doubling time in terms of cases. And over the next 7 days, between the 7th of March and again the 14th of March, there was nearly a 20-fold increase in cases. And again, I want to emphasize those numbers because they reflect just the speed with which this disease can explode in certain conditions, not all of which we well understand. Since that time, since mid-March, again, as most people on the call will be available, the state of emergency was declared in addition to the measures already that were in place, the extensive public health measures. The state of emergency was put in place and in a sense, a stay-home order for the entire population. And it's interesting, in Spain, they've done some fantastic work to understand what was the impact of that on mobility. And using some very clever big data, especially from mobile phone providers, et cetera, they could document that there was a fully 70% reduction in the mobility of the population in Spain. That was accompanied then with a slowing in the rate of increase of cases, such that the doubling time from before in the first half of March was about every 2 days for cases to the second half of March when it became every 5 days. And then, as you know, by the 30th of March, a further tightening of that lockdown was put in place to try and further reduce mobility because of the concern that without such measures and a further reduction in mobility, further reduction in new cases, the health system would be completely overwhelmed in terms of its ability to deal with new cases. And by the time I left the country, a very positive development, the regional director referred to this, was the fact that the cases in terms of the doubling time had been extended even further and was over 8 days. And those are very concrete figures that give us the sense of, I don't want to use the word optimism because in the face of such devastation and destruction and illness in a country, that is the wrong word, frankly. But there's hope, at least, and evidence that this outbreak is definitely slowing down, and it's a result of what are some extraordinary measures. And maybe if I can just say a word about those. So that's a little bit about the outbreak itself. In terms of the clinical picture, it was interesting. It's very similar to the clinical picture that you see elsewhere in terms of this disease, in terms of the age distribution, male, female distribution, et cetera. But one of the interesting things that again, I think is often forgotten as we think about this as a lung disease is the amount of disease that it can cause in individuals and how sick people can get with COVID-19. And not just old people. 63% when I left of the people who were in ICUs were less than 69 years of age or less. And in some of the places I visited, nearly 80% of the cases were less than in the ICU, were less than 70 years. So this strikes that working age population in countries very, very hard. And one of the things that I was left with was the consequences of this. Once people are in the ICU in Spain, they are there for 3 weeks and they come out very, very unwell and requiring long rehabilitation, et cetera. And one of the ICU docs, who has many, many years of experience in the country with very serious diseases, he said, it's wrong to think about COVID as simply pneumonia because this disease has an extraordinary impact on so many of the systems in the body, and it results in such truly devastating disease, not just at the level of the communities, but also very much the level of the individuals. The other point I made, just before I get to a couple of wrap-up, was in terms of the response itself. And I've said this in other fora, but just to the reporters present, what I saw in Spain was truly heroic, extraordinary and innovative response. And I want to speak first just to the work of the frontline providers, and to any of them who might by some chance actually see or hear anything of this. But the work they are doing is truly inspirational. The lengths of the shifts that they work, the transformations that they've achieved of their health facilities, the transformations they've achieved of the way they work as teams and as individuals to save lives, is truly inspirational. And one leaves with a deep admiration for the heroism. And it's expressed in the hours that these people are working, as well as the innovative and can-do approaches to solving the substantial problems one encounters with such an overwhelming hit on your health system. I also want to just highlight how impressive the response of the Spanish people themselves were. Madrid, many of you may have visited, is an extraordinary, vibrant city, as is Toledo, as is Barcelona. The streets are empty. The stores are shuttered. The roads are without either pedestrians or vehicles. It's the most extraordinary, let's say, population level collaboration to try and slow down this virus, because the people of Spain recognize that their staying home is what reduces the demand on the health system, the new additional cases, and they're cooperating with what I thought was a tremendous display of unity. And then finally, I want to recognize and highlight, because it's another part of the response, is just the work of the government at the national level and in collaboration with the close collaboration with the regions in Spain. The country is facing all of the challenges every country faces, but on a whole other scale because of the size and numbers of cases involved, the size of the outbreak and number of cases. So the PPE shortages we see in other countries are even more acute, even greater. The strain on testing, even greater in a country which has got such intense transmission. The demand for ventilators, even more difficult. And similarly, when it comes to ICU beds, where they've had to quadruple and even quintuple the number of ICU beds to be able to meet the demand. And what's been impressive has been the resolve with which the leadership has tried to address these issues, repurposing national industries where necessary, reaching out to all stakeholders, looking at innovative ways to adjust testing algorithms. All of this extremely impressive. And for me, visiting, having worked 40 years in this business, truly inspirational. So the last point I just leave with is 4 big takeaways from Spain that will affect our thinking, continue to affect our thinking, reaffirm some of the things we know, but also help us as we drive with the regional director, the response in Europe and globally. So the first big takeaway is, seeing the tremendous risks and consequences and astonishing speed with which this disease can explode in some settings, the extraordinary measures that are being implemented in areas of low incidence, et cetera, are fully warranted. And again, I know populations often find these difficult and they think, why are we doing so much? Because there's not very much disease. This is a disease you definitely want to get in front of, and such measures are warranted. On a second point, it's just with respect to the health systems. Spain has an extraordinary primary healthcare system and quite an impressive tertiary system as well. As I looked at it, I hadn't seen that before, but it was impressive. But the takeaway, the second big one, is the most robust of health systems can be completely overwhelmed and compromised by COVID-19 in a very, very short period of time. And that requires areas that have not been hit like this to be doing the contingency planning that includes extreme scenarios. Many countries I've talked to say, yes, we have an isolation ward or we have an isolation, beds, but one needs to be thinking about extreme scenarios. Whole hospitals of 1,000 beds are now COVID hospitals in Spain. We don't want to see that reality anywhere, but one has to think it through because of the nature of this disease. Repurposing on a scale we hadn't even thought through fully. The third big takeaway, lockdown super important. They will slow the virus, but they don't stop it. And as the regional director said, we've got to accelerate the rate of decline by ensuring we are testing all cases, making sure we're effectively isolating the mild cases so they are not continuing to drive the outbreak, because there is still new pressure on the health system, which is creaking under this strain. And then finally, is this lockdowns, which we've seen in so much of the world right now, they provide a window. And it's a window to prepare for the post-lockdown period, which will continue to be the new COVID reality in which we live now. And we have got to prepare for that reality properly. We've got to ensure we have got the public understands we're moving to a new phase. It's not lifting lockdowns and going back to normal. It's a new normal. They have to understand it, understand what it entails. We've got to understand and have the ICU capacities. We've got to build the public health capacities, most importantly, to test all suspect cases and to be able to properly and effectively isolate the mild cases that continue to drive the outbreaks. We've got to understand special settings where it amplifies, and we've got to be able to manage importation. So there's 4 or 5 major elements. And in Spain, very impressive work is going on. They're using this window of the lockdown extremely hard to understand and build the conditions they need for a safe transition and to build the capacities. So finally, in wrapping up, thanks for the opportunity to share some of what we saw, important lessons for the entire global response. But I'd like just once more to reiterate how impressed I was with the heroics of the frontline health workers, the unity of the people of Spain, and the resolve of all people in leadership positions there to get the country through what is one of the most challenging public health crises I hope we will ever see.
Bruce, thank you very much for those words, from the reflections and your experience, very much appreciated here. We're going to expand the panel now to Dorrit Nitsan also and Catherine Smallwood, who are joining us as part of the emergencies team on this panel. So Bruce, Dorrit, Catherine, and of course our regional director Hans Kluge, thank you very much for forming this panel. We'll take a few questions now. Thank you for raising your hands, the press that have joined us. So we'll go straight over to Jamie Keaton from Associated Press. Jamie, can you hear us, and are you there? So we'll go straight over to the regional director to answer the first question from Jamie.
Right, as a regional director, I'm overlooking the 53 European member states. I would say we are now still in an acute phase of the pandemic, so this is not the time to cut back on funding. I would like to express the appreciation to the many WHO European member states, the World Bank, the Bill and Melinda Foundation for financing and stepping up support to the WHO Global Solidarity Trial, which is so important to find the right treatment regimens, but also the right vaccinations. Ultimately, health is the responsibility of the country's national competency, but WHO is there to further step up our support, which definitely in my life I could describe as unprecedented. Thank you.
Great. And Bruce, could you take the second question, please, from Jamie?
You might be on mute.
Yes, I'm delighted. So first, with respect to China, this is such an important part of the international crisis that we're facing right now. As everyone on the call knows, this virus appears to have emerged out of Wuhan in China. By the beginning of February, China had, or certainly by the time we were there with the mission, of course, around the middle of February, thousands of cases, and by far the vast majority of the world's cases and the vast majority of the experience with this disease. So it was absolutely essential that we work very, very closely with China to understand this disease. And in fact, the mission that James just referred to, the purpose of that was really threefold, right? It was to understand, first of all, what was the seriousness of this disease? Because in the West, we didn't know, were we dealing with flu? Were we dealing with SARS, as you know? The second big thing we had to understand is, how is this transmitted and how does it move? Because that's so important to potential control strategies. And the third big piece was, we had to understand what was the approach that China was taking, which appeared to be slowing this disease? And then if, given that, was this a strategy that could be applied in other places that might face the disease? So it was absolutely critical in the early part of this outbreak to have full access to everything possible we could in China, to get on the ground there, work with the Chinese to understand this. And of course, we had to speak to that a great deal because there's been an awful lot of questions about what worked, what didn't work, etc. So that can be perceived in different ways potentially, but it has just been such an important part of being able to manage what is truly an extraordinary and devastating public health crisis we're all in the middle of. But
okay, thanks.
I would just say is, single country, other hard-hit countries like Spain, where I was just asked to go, it's got nothing to do with China specifically. It happened to be the place where this started, but again, we're trying to provide similar support as needed to affected areas.
Okay, thanks very much, Bruce. Thank you very much for those points. And thanks for the question, Jamie. So we'll move on to Antonio Brotto from EFE. Antonio, are you with us?
Yes, I am. Good morning. Can you hear me?
Please go ahead. We can. Please go ahead.
So my question is for Mr. Bruce Aylward, because many people in Spain are still saying that the Spanish government acted too late, especially in the first days of March, when many mass events were allowed. And he said, Mr. Aylward said that at these days, the number of cases were already doubling in a very short period of days. So, Mr. Aylward, what are your views on that? And were the recommendations of WHO to Spain in those days, were they listened by the Spanish government?
Thank you, Antonio. Over to you, Bruce.
Yeah, thank you very much, Antonio. First, I want to be very clear. We're in the middle of a war here, and a very, very serious war that the consequences of which we're only starting to understand. And having been in this business a long time, my focus is on fighting these wars forward. We have got to accept we are in a situation that we are in today, and we need to do everything possible at this point to save lives, reduce the intensity of transmission, and get societies and economies back to I can't say a normal, but the new normal way of functioning. So the focus of the mission very much was on that. Yes, we looked at the early days of the outbreak, of course, but in every single country, one sees a doubling of cases. And, Antonio, we don't know why this disease explodes and moves very, very quickly in some countries relative to others, because you can find very similar early experiences in countries with very different outbreaks, which is part of the challenge of dealing with infectious diseases in general. I'd also remember that, this is a disease where we have to be very careful about saying right and wrong. We've only known about this disease for 4 months. We're learning very, very quickly. The important thing is to assess, are the measures you're taking working or not? And then rapidly making the adjustments necessary as one goes forward. And, for every country, that is the key piece of this. Every country is trying to do the best possible thing for its people. Every government is trying to do the best possible thing for its people, and we're all learning as we go forward. I think what we are learning is speed is very, very important, but it's only one element of success in fighting this virus. I remind as well that the key to stopping this virus is not lockdowns. The key to stopping this virus is rapidly finding, testing the cases, isolating those cases, and doing contact tracing. And that is something that Spain did very, very impressively right out through the beginnings of March, et cetera. And there was a certain point where, boom, the cases exploded even faster, and that strategy no longer works, and one needs to move to more dramatic measures. So again, I think it would be very, very difficult, and certainly one of the purposes of our being there, to go back and say something was right or wrong in the early days. We are where we are now. We have to get this finished. And what I saw was an extraordinary commitment to do the best possible measures at the best possible time for the Spanish people.
Thanks very much. Thanks very much, Bruce. And thanks to Antonio for the question. We're next going to go over to Julio. I don't have a surname, so excuse me, Julio, at Redacción Médica. Julio, please, your question.
Yes, please go ahead.
Okay. Well, the epidemiologist Sergio Romagnani has criticized the OMS strategy of not recommending the use of face masks for the population. He argues that in Veneto, these masks have been useful to reduce infections. Something similar have been said in China. What's the reason why the OMS don't recommend the use of masks for population? Is it because of the supply shortage, or do you have other reasons? Thank you.
Okay, that's a good question. I'm going to pass that over to Dorrit Nitsan, acting World Health Emergencies Programme lead here at the WHO Regional Office. Dorrit, please.
Thank you very much. Yeah, this is a question that we get all over, and we have to remember the way what we recommend. We continue recommending that medical masks must be used by the healthcare workers that are taking care of the patients, must be used by patients and those who take care of patients. Also in special settings where there are patients, we have to use them. We continue recommending it as a real important measure, but it's not a standalone. The thing that is very important, and we see how it is working in communities, while people wear the masks, whatever they are, they think that they are protected. They continue to disseminate the disease, and this has to come in the full package. For this, we are saying, first of all, take care of those that really would benefit from that. If you have extras and you want to help, then give it to other countries where healthcare workers are in need. We really need those to save the lives of those who save our lives. And therefore, it is important to remember that the masks themselves come in a comprehensive way. So it is part of a comprehensive treatment, comprehensive intervention. Thank you, and back to you, Rob.
Okay.
Thanks, Dorrit, for that response. Next, I'm going to go over to Christian Rochema from the Abertoni Foundation. Christian, are you there? Okay, I'm going to move on because we have a long list here. Esmir Milovic from N1 TV Sarajevo, Bosnia. Esmir, are you there? Have you a question for us today?
Yeah, I'm here.
Great.
I have a question for Professor Kluge. Professor, what is your view on the current situation in the Western Balkans region, especially when it comes Bosnia, Croatia, and Serbia? And we have, if I may say, very troublesome situation here with one of former experts who worked with the WHO who passed away in Sarajevo just a couple of days ago. So my question is, what is your view on the current situation here in the Western Balkans? Thank you.
Thank you, dear colleague. So we have weekly video conferences with the ministers of health of the Western Balkan. In fact, just before the COVID-19 situation broke out, I went to two of those countries myself. So we keep a very, very sub-regional focus over there to work together on the, what we call blended approach. The containment, the mitigation, the mobilization of the society. On the details itself of country specifics, I would like to give the floor to our expert, the Acting Director of Emergencies, Dr. Dorit Nissan.
Yeah. Yes, indeed, we are working in the Western Balkan very closely with the authorities. We have a hub there that is based in Belgrade with teams all over in the countries, also including Bosnia and Herzegovina. We are following the situation daily. We are following the reported cases, the needs, and also we are seeing the measures. For example, the measures in Bosnia, as we are following them closely, are taken step by step, and Bosnia was one of the countries that implemented them in time. As we heard, the virus knows no borders, and it comes to us from different directions. However, each of these countries, I can assure you, we are working really closely with them, is doing the maximum and doing the efforts. What we recommend now to all countries, actually we continue recommending, is to look and pay attention, as our regional director and Dr. Edward said, we are really wanting that everybody will look at the mild cases. Those are the engines. And now we are working in order to get the community out of these strict measures. We need to ensure that the surveillance and the patient identification, isolation, quarantine of those who are traced contacts, all works in one package. All in all, Bosnia, Serbia, and the Western Balkan are, for now, really, we are happy to work and we see good results. Thank you.
Thanks very much, Dorit and Hans. So I'm going to go over to John Lauerman from Bloomberg News. John, your question, please.
Thanks very much. Thanks for taking my question. I wanted to address my question to Hans Kluge. So we've heard from some countries that they're already, some European countries, some of the most afflicted, that they're already discussing easing of lockdowns, easing of measures. They haven't said exactly which measures they're going to ease, but I wonder if you would comment on whether you think these discussions are appropriate now, whether they're premature. I think you said, you know, we're it may be, you know, that we need to keep these measures quite tight for the time being. Thank you.
Thanks, John. Very relevant discussion, and indeed I came back to that one in my press statement. So this is a mixture. The whole response to COVID-19 is a balance between protecting the health of the population, the social and economic impact, and then of course the human rights. So every country has to decide upon itself. What we try to do as WHO is to convene the countries so to synergize towards, let's say, a mainstream policy, because one country alone, this is very clear, also what Bruce told, cannot tackle or stop this COVID-19. It has to be done globally in solidarity. So we're really working day and night on the framework according to a number of dimensions, including behavioral insights. In fact, we just published the guidelines on that because a lot of this has to do with the behavior of the population and their support, but also with the new technologies which are really accelerating in process, including the diagnostics and hopefully also the treatments. And then, of course, the big data and the health system response. We're going to convene the senior advisory group to the region director, to myself, on Tuesday. Friday, convene the minister to give further guidance. Whatever the countries decide, it would be a mistake to what I call lower the guard. So it has to go like China, Singapore showed, in a gradual way while beefing up the capacity. It's not about flattening the curve. Ultimately, it is about cutting the curve.
Super. Thanks very much, John. And thanks, Hans, for that response. So I'm next going to go to Alvaro Zamareno from Cadena SER Radio. Alvaro, your question, please. Okay. It doesn't sound like we have Alvaro. We can't hear you, Alvaro, so I'm going to have to move on. Gabriela Sotomayor from Mexico Prosecco outlet. Gabriela, please. Are you there?
Are you there?
Yes. Thank you very much.
Great, go ahead.
Yes, I'm a Mexican journalist, UN correspondent here in Geneva. My question is, I have two questions. One for Bruce, and the other one is for the director regional. Yes, so for Bruce, Mr. Trump, president of the USA, is blaming WHO of not advising travel restrictions from China, especially at the beginning of the outbreak. So I would like to know what is your answer to that accusation. And then for the director regional, I would like to know from the public health point of view, where to put the accent in testing, case isolation, or in the so-called lockdowns. I have the impression that in countries that are beginning to deal with the pandemic, like Mexico, for example, they think that confinement is enough, it's sufficient. I mean, with that is enough. But they are not doing the massive testing that you are recommending. So my question is, if you have to choose between one measure or the other, which one would you emphasize, or which one would you choose? Because in countries like Mexico, for example, people need to work to eat, literally, so they can't afford to stop. So those are my questions. Thank you very much.
Okay, thanks very much. Let's Bruce, we'll go over to Bruce first, if we could. Thanks, Bruce.
Gabriela, thanks for your hi, and thanks for the question. So the critical thing in a crisis like this is to make sure that the cases, the people who are actually infected and their close contact, important, if you want to call it restriction, internationally, that will actually reduce the spread of the virus. And China worked very hard, very early on, once it understood what it was dealing with, to try and identify and detect all potential cases, to make sure that they got tested, to trace all of the very close contacts, make sure that they were quarantined, so that they actually knew where the virus was, where the risk was, and then they made it very clear that these people could not and would not travel within the country, let alone internationally. And so that was the key measure to being able to reduce the spread out of the country as it started to evolve. But then China went a step further even and restricted the movement out of the country itself from the key infected areas, or even out of the infected areas like Wuhan itself with the lockdown. So those are the key measures that need to be put in place to reduce the risk of international spread. Because of course that's got to be balanced with how are we able to move goods, services, et cetera, that are going to be critical to maintaining societies and economies, as well as the international response. So that's the critical thing when it comes to managing the virus and potential movement out of China.
Great, thanks very much, Bruce. And I think we'll
over to the RD for the second question from Gabrielle, please, RD.
Yes, the most frequent question that I'm asked is by the governments, are we doing too few or are we doing too much? So we always advise a blended strategy. what we need is a comprehensive public health strategy with a lot of support of society, because no pandemic has been pushed back without really a whole of society approach. The key issue Bruce was just reminding us is really to quickly, aggressively identify the suspects, isolate, test them, if need be, treat with dignity. But it depends a lot on the stage of the epidemic in a particular country, and of course also on the capacity. If at one point you're overwhelmed, we have, like in a war, then to specify what are the priorities. And in that sense, WHO is always ready with the country, upon request of the country, to do together a risk assessment. In Mexico, we have a great region director, Dr. Carissa Etienne, with a lot of experience, who is the region director in that part of the region, who is working with all the countries, including Mexico. So it's a comprehensive approach, and you're absolutely right that governments to pay a lot of attention to the people, particularly the vulnerable, whether they have the social care, they have the mental health support, and whether they have, of course, the basic economics, particularly if they would lose the job. Thank you.
Okay, so thank you very much, Hans. On that note, we've gone past the top of the hour, and I'm acutely aware that we're going to start losing our panel members shortly because they have other commitments. So I'm going to thank you all. I can see there's a whole host of other questions that you wish to ask. We will endeavour to extend the time for Q&A at next week's press conference, virtual press conference, which is taking place next Thursday at 11 a.m. CET. So I welcome you back then, where hopefully I will get through, or we will get through, more of the questions at that point. So it only remains for me to thank Doric, Katie, Bruce, and our Regional Director, Hans Kluge, for joining us today, and for you online for joining us on this virtual press conference. So thank you very much for joining us. See you next week.